Welcome to Community Health Matters. I'm your host, Amy Marsalis. On today's show, we'll learn about the importance of colorectal cancer screening, getting your annual flu shot, diabetes, and how to safely dispose of medications. All of that coming up next on Community Health Matters. From the News Channel 5 network, this is Community Health Matters, sponsored by the United Health Foundation. I don't know if you all have heard about the FluFit test, but this is an award-winning and research-tested program that really helps healthcare providers to get this information that could save somebody's life. Dr. Karen Cassidy is here again. Nice to see you.
Yeah.
Now, how does this all work? Because, you know, we know that colorectal cancer is one of the most preventable cancers,
Sure.
but you've got to get that information. You've got to go for the screening. So this is a new way of sort of capturing those people, right?
Right, so flu shots are something that most people participate with. And so when you go into your physician to get your flu shot, the idea is, you're here, let's get you a screening test. So the ideal screening for colon cancer would be to go and have a colonoscopy. And the recommendation is if you're over 50, between the ages of 50 and 75, you'd have that done every 10 years. There's just a lot of barriers to getting that colonoscopy done. And many people don't follow up, they don't get it done, whether it's scheduling or not wanting to do the prep. There's a lot of reasons why that happens. So the nice thing about FluFit is you go in and get your flu shot and you actually get a card. It's a fecal immunochemical test. You take that card home, follow the instructions, mail it in, your doctor will get those results. And so that lets us do a screening test that if that were positive, we know we really would want you to follow up with that colonoscopy. But it really increases that capture, and that test is good for a year. It's an accepted screening test for colorectal cancer. It doesn't give you that 10-year window that colonoscopy does. But for the next year, you know you've done that screening. Next year when you go get your flu shot, do it again.
And again, you should be getting these screenings really starting at age 50, right? 50
Yes.
to 75?
There's some rare diseases or family histories that would be different. Your physician would let you know if that you were in a different subgroup. But overall, the vast majority of the population is in that 50 to 75 category that they would be in the screening range.
How common is colorectal cancer?
So it's the second leading cancer diagnosis in the United States. People don't realize that. Yeah, it's really high. So very common. You know, 50,000 people die a year from colon cancer. So very important to get that screening. And the thing about this screening is, if you had a positive FluFit test and went to colonoscopy, that colonoscopy you can see precancerous polyps, the very early stages of cancer, where you're either catching it early or removing those polyps, hopefully precancerous polyps, before they go on to convert to being full-blown colon cancer. So that screening is really important for, one, preventing, but also, two, early detection and treatment saves lives. So very important testing to have done.
I saw one of the stats up on the screen. I don't know if we can pull that up again, but it said there are more than 1 million survivors of colorectal cancer each year.
And that really honestly is a testament to how important that screening is, because if you catch it early, it's a survivable cancer.
Wow. Now, where can you participate in these programs?
Yeah, so when you go to see your primary care physician to get your flu vaccine, ask them about the FluFit program. This is a program through American Cancer. It's something actually United Healthcare is working with the American Cancer Society and co-branding
a partnership,
it there.
You're co-branding it.
Yeah, so if United Healthcare is your carrier, then your provider hopefully is participating. There's no cost to the provider or to the member to do that screening test, to do that kit and get it sent in.
Oh, that's more of an incentive too.
You know, we think it's an important screening. It's one of those preventive screening tests that we really encourage our providers to be working on getting all of our members screened. We want all of our participating members to get it done. We think it's really important.
Are most of the primary care providers in Middle Tennessee, they're pretty good about getting their patients to get a flu shot in the first place, right?
Absolutely.
So this is sort of a double whammy, if you will.
Absolutely.
And
right.
Okay, so and the idea of combining the two again is
to
just
kill two.
Counterintuitive,
well, doesn't it? Yeah, flu shot and colorectal cancer screening. I think the idea is you're here in the office today. you're thinking about your preventive care, you're getting this vaccine. Let's capture that moment and go ahead and get that colon cancer screening taken care of at the same time.
Do you think the mentality for a lot of people when it comes to colorectal cancer is that they are scared? They're scared to find out maybe they do have it. Like,
I think there is
ignorance
some
is
of that
bliss
with
in a way.
any cancer
Yeah.
screening. I can't stress strongly enough that, boy, if you feel that way, take a deep breath and know, even if today you did have colon cancer, boy, I'd want to catch it today, not next year or next week. So again, that early detection is so important. And many people, if they have that colonoscopy or have a positive test that goes on to colonoscopy, if they've got those precancerous lesions, a lot of times they're removing those before they ever go on to be cancer.
And that's critical.
Yeah, I mean, it's just really important.
How often does a polyp, do you have numbers, the percentages of a polyp going on to become cancerous?
Yeah, there's so many different types of polyps, so it's a little hard to
Okay.
kind of give a number, but we clearly know there are some polyps that are prone to going on to be cancer, and so those are the
Gotcha.
types of polyps. When we can get those removed before they've made that transformation, it's very, very important. I mean, it saves lives to get the screening done.
We know that some people are more prone to having
Sure,
polyps
absolutely.
too. Doesn't mean they're going to go on to have cancer, but
It
they may
doesn't.
just produce more polyps.
And some people, if you are someone who has lots of polyps, particularly if you've had precancerous polyps, definitely talk to your doctor about what your personal screening regimen should be.
Also, a lot of people have concerns about getting a flu shot. Let's
Yep.
talk about the benefits of getting a flu shot.
Yeah, so there's lots of
Misconceptions, aren't there, and myths?
And myth might be the
Myth.
right word.
Myth.
Flu vaccine is incredibly safe. We do know that the risk of flu far outweighs any risk that the vaccine has. So particularly for people who are very young or elderly, people who have lung disease or any other kind of medical issues that might predispose you to have more complications if you were to have flu. Flu vaccine is, and I realize we're talking about flu fit, but the flu is part of it. That flu vaccine is just really important. We've been saying for years now we're waiting for a pandemic flu season. I think we really do have this kind of sense that there's potentially a bad flu season on the horizon, so we really do want to see people getting that vaccine.
Like we're due for a bad winter also,
Kind
right?
of, yeah.
I hate to say that. Okay, so Flu Fit is the name of it.
Yes.
Keep that top of mind. And to learn more about this,
Yeah, you can go to unitedhealthcare.com and look up FluFit, or you go to the American Cancer Society website. They would also have information there.
also cdc.gov. All right,
Yep.
Karen Cassidy, thank you as always good to see
It's
you.
good to see you too.
Great
Thanks for having me
information.
on.
Thank you. Stay healthy this
You
winter.
too.
All right, and we'll be back with a lot more right after this. And next we're talking about diabetes. November is National Diabetes Month in the United States, and we here in Tennessee have a pretty big problem with this disease. It's very prevalent. Rachel Fox is a nurse practitioner at St. Thomas. Welcome to the program.
Thank you for having me.
And so you see a lot of patients struggling with diabetes in your practice or at St. Thomas. Talk to us about how preventable diabetes is.
You know, diabetes, type 2 diabetes in particular, pre-diabetes is the time to capture diabetes and prevent the onset of type 2 diabetes. And there's several interventions that we can intervene with lifestyle modifications, dietary modifications, and there are studies that suggest initiating medication therapy with metformin is very effective in delaying the onset of type 2 diabetes particularly. So,
Describe, educate us more, if you will, on the difference between type 1 and type 2.
well, type 1 diabetes is an autoimmune disorder, and what that means is the body's immune system essentially attacks itself. Its own, it's supposed to defend the body, but it turns on itself and kills the cells inside the pancreas. And for that reason, insulin is only treatment for type 1 diabetes. Type 1 diabetes tends to affect, it can affect children and adults, but primarily starts in children. And type 2 diabetes is by far the more common. It affects 90% of the people affected with diabetes. So when you hear the term diabetes thrown out, typically that's what they're referring to is type 2. And it's just a metabolic disorder where The pancreas that produces the hormone insulin is not producing enough adequate supply, and the insulin that is being produced is not functioning properly in the body, which leads to high blood sugars.
And that leads to, in turn, other health problems for patients, such as?
Well, think with me for a minute, because blood goes everywhere, and when you imagine everywhere that the blood flows in the body, you can get a picture of what all it affects. And glucose is a very sharp and jagged molecule on a molecular level. So when you put lots of concentration of glucose into the bloodstream, and there's high concentrations of that flowing throughout, it can cause lots of damage throughout the body. So what that turns into with the eyes, blindness, retinopathy, with the heart disease, heart attack, stroke. With the kidneys, you can go into renal failure, kidney failure, and require dialysis. And the nervous system, nerve damage, where you can lose sensation over your body with feeling, and peripheral circulatory disorders that eventually can lead to limb loss and amputation.
Devastating losses, devastating
Absolutely.
side effects from diabetes. You painted a very clear picture through your description just now of the jagged molecule. I've never heard anybody describe that, so that really brings it home. So talk about prediabetes, and what is that, and how can we stop it in its tracks? You mentioned through lifestyle modifications.
Well, prediabetes is the precursor for type 2 diabetes, and so the blood sugar is elevated, but not enough to receive the diagnosis of type 2 diabetes. And so that is a great time to implement some interventions, like I had mentioned, lifestyle modifications, weight loss, increased activity, increased exercise, and healthy dietary choices are all very, very powerful in not only preventing the onset of type 2 diabetes and delaying that onset, but even people with type 2 diabetes and slowing the progression of the disease.
What are some of the symptoms? How would you know that you are getting into dangerous territory?
Well, the three classic symptoms are polyuria, polyphagia, and polydipsia, which just mean that there's excessive thirst, excessive hunger, and excessive urination. And those three are often combined with an unintentional weight loss because of the degree of dehydration that's going on in the body.
Okay, you said increased hunger and fatigue. What about, do you have, you see blurred vision, obviously, that comes along with
Blurred vision, recurrent infections, weight loss, like I mentioned.
It says here numbness or tingling in the feet or hands, sores that don't heal. Now that's, at that point, you're pretty far down the pike with it, right? Some of these things, I mean.
Sometimes it can go undiagnosed for years, and so some of those symptoms are actually symptoms of the complications of untreated diabetes.
Do you see that often?
Very often.
How do you reach people? I mean, obviously this kind of program, but what else is being done in the healthcare field to reach more people who are unaware and, you know, are not educated on taking good care of themselves?
Well, I work in the hospital with St. Thomas, an inpatient, and we do a lot of screenings on patients that are having surgeries or just in the hospital, and we identify that there's some hyperglycemia and high blood sugar going on, and we do screenings to expedite that diagnosis, and especially even capture people in that prediabetes state, and from there give them referrals over to the St. Thomas Diabetes Outpatient Clinic, where they can get not just education, further education, but also the treatment and interventions, meeting with a dietitian and making those, helping implement some of those dietary and lifestyle modifications.
Does it tend to run in families?
There is a very strong family component to it, so that does increase the risk when it runs in the family.
How can you best manage diabetes? You know, once you have it, how do you really maintain a healthy lifestyle?
Well, in addition to the lifestyle modifications and the dietary healthy choices, I would add to that testing blood sugar, being very aware of your personal trends, and with glucose monitoring, following up with your healthcare team, communication, and being very consistent in taking your medication as prescribed, support groups, staying connected with the community, staying connected with family and friends. And one that's not often talked about is just maintaining a healthy mental state and mental health, so that internal motivation is there, because diabetes can be a very challenging disease to manage for healthcare professionals and people with the disorder alike. So.
That's a critical component. I'm so glad you added that. Thank you so much for your insights and educating us more about diabetes. Thank you, Rachel. Thanks for coming in. And we'll be back with more of the program right after this. You may have heard this before, but you should never dispose of your medications by flushing them down the toilet or putting them down the sink. That is not the thing to do. And here to educate us about this really important topic is Sarah Cooper with the Tennessee Department of Mental Health and Substance Abuse Services. Good to have you here.
Thank you.
And next to her, Kathy Gloppa with the Tennessee Department of Environment and Conservation to talk about prescription drug take-back boxes. And pretty self-explanatory, but you're here to explain a little bit more to us and tell us why we need to have these instead of just tossing them in the trash.
Sure, they're very important. We have an epidemic of opioids, especially in this country. And so we really worked with the DEA and other agencies to develop specialized locked boxes that are housed in secure locations where people can either return their prescriptions or drop off their prescriptions that maybe they aren't using anymore or that they have expired. And really the purpose is twofold. It's to keep them out of the streams and in our water system, but also keep them out of the hands of people who may misuse them.
Because that's a real problem, isn't it, with people that have a problem, an addiction to these prescription drugs, which is so prevalent, unfortunately, that if people are working in your home, or I've heard in open houses sometimes this happens when people are showing their home, that people may go through looking for prescription drugs. Is that the case?
I think so. The biggest thing is there's health, safety, and the environment. There's a trifecta that we're trying to protect, and the take back boxes, like Sarah was saying, are located in law enforcement, pharmacies, and they're under surveillance. So it's a safe place to take your expired or unused medications to, so people can feel safe about disposing of them properly.
I was going to say, why is it so important to properly dispose of them? I mean, for the environment is one.
For the environment side, you don't want to put them in the trash because people can go digging through your trash, so that's the safety side also. And when it goes to the landfill, it could eventually end up in our water through leaching through the system in the landfill. And then flushing, you just don't want to flush because it's really hard for the water treatment plants to treat those types of things. Our body excretes it naturally when we take medicine, and they're having to treat those as well. So
when it's not filtered out by the body is what you're saying, the water treatment plants,
it's harder.
They just don't, it's more difficult to know how to deal with it.
There's a really interesting and I think very profound statistic out there that says that 52% of the drugs that are misused by youth age 12 and up are actually received by a friend, a family member, bought or sold, through that, compared to 4.9% that are actually sold and bought on the street. So the majority of the prescription opioids specifically that are out there that are being transmitted back and forth and misused are actually coming from legal prescriptions that people have, that they're sharing, that they're having stolen from their house, that are just sitting around, and you have you get prescribed, 30 days worth of Percocets, you take 2 or 3 of them and you put them in the cabinet, and that's unfortunately how they end up on in the hands of kids. And
What
others.
types of medications can you dispose of in the boxes then? You're talking about opioids, or can it be anything?
Tylenol, acetaminophen, vitamins, ointments, pet medications. Sometimes you don't use all of your pet medications. So those are some of the items that you can take to the drop boxes. So over the counter and prescribed as well.
Lotions or drops, I see that on the list. So even eye drops, liquid medications in leak-proof containers.
Correct.
So you want these things sealed up,
Yes.
if at all possible, or they have to be. And how can you safely dispose of medication at home? Let's say you can't get to one of these sites. How can you do it at home? Is there a way to do it properly? I know you'd rather them bring them to the boxes, but is there a way?
There are some pharmacies carry, and we're actually working on an initiative through some of our anti-drug coalitions throughout the state to bring in bags that you would receive with your prescription. So say if you got a prescription and you were not going to complete the whole thing, you could actually mail it. It's a pre-labeled bag where you could put it in, and it's mailed back, and the pharmacy itself is responsible for disposing, which is separate from the DEA initiative, but it's another option.
Where can you find these take-back boxes? You mentioned earlier police stations.
So there's one in every single county in the state of Tennessee. All 95 counties have at least one or more, and they're typically at a sheriff's or a police department.
All right. Okay, and is pretty visible, pretty easy to find.
They're the size of a mailbox. Like if you were to go to the post office and the big mailboxes, they're that size. They're large.
All right.
So you wouldn't miss them.
That's good. Have people been pretty compliant doing this, or not compliant, but have you had a lot of participation, I should say?
70,000?
Since we've been collecting the numbers in 2012, it's over 240,000 pounds collected.
Incredible.
And this year so far we're at 76,000 pounds, and we have 2 more months to go. So we'll reach 100,000 in 2017, which is good and bad.
Saving lives and saving the environment both.
Yes.
And if you or someone you know has a prescription drug problem, addiction, where do you turn for help?
Absolutely. I encourage anybody who has an opioid addiction, especially alcohol, call the red line. Hopefully the number's on the screen, I believe.
It is. It's right there under us. Okay.
889-8789.
Great.
Yes, please. It's a 24-hour referral line. Great resource and lots of opportunities to recover.
Thanks so much, Sarah and Kathy, for coming
Thank you.
in. Thank you. Thank you for watching Community Health Matters. Learn more ways to improve your health at mycommunityhealthmatters.org. And remember, here in Middle Tennessee, our community health matters.